I'm Laura Wright, and I'm going to be inserting a nasogastric tube today. So the first thing that I want to do is verify my physician's order, and I'm going to be looking at the patient's medical history to look for any deviated septums or nasal surgeries. So once I've done that, I'm going to go ahead and gather my equipment and wash my hands. I'll then identify my patient using two different means, so have them tell me their name and date of birth, and I'll compare their wristband, and then I'll go ahead and provide for privacy. At this time, I'm going to assess their mental status, so I'm going to look at if they can tell me where they are, the place, and their name, and what time it is, so I can see their orientation. So once I've assessed the mental status, I want to tell the patient that we're going to be inserting a nasogastric tube today, and tell them to raise their hand or a stop method of their choice once I hit the back of the throat, which is the pharynx. Then I'm going to go ahead and assess the abdomen. So the first thing that I'll do is inspect the abdomen, and I'm looking at the contour and for any abnormalities. Once I've assessed, I'm going to auscultate by listening to the bowel sounds in each of the 4 quadrants for at least 2 minutes, and if I don't hear them, I'll listen longer for about 5. And I hear the bowel sounds in each of the quadrants, and I'm just going to palpate, feeling for any distension or abnormalities. I'm also making sure to look at the patient's nasal area for any issues or areas of concern prior to inserting the tube. So once I've assessed the abdomen and looked at their nares, I'm going to go ahead and put the patient in a high Fowler's position as long as they can withstand the pressure. So at least 45 degrees, but hopefully 90 at the high Fowler's. And once our patient is in the high Fowler's position, I'm going to drape a towel across them, across their chest, and I'm also going to go ahead and don my gloves. At this point, I am going to measure the tube. And I'm going to measure this appropriately by going from the tip of the nose to the ear, and then down to the xiphoid process, and that is where I will mark my tube. I then can go ahead and lubricate about 2 to 4 inches of the tube. I'm then going to tell the patient to flex their head slightly back towards their pillow, and I'm going to insert to the pharynx, and that's when they're going to use their stop signal. So I insert to the back, and they're giving me a stop signal. So this is when I can provide a little bit of water and have them swallow and move their head flexed a little bit forward as I advance the tube a few inches per swallow. So I'm going to insert this tube down to my marking. So now that it's to the place that I've marked, this is when I can go ahead and secure the tube to the nose using tape. Or a butterfly strip. I'm then going to go ahead and aspirate using my syringe to verify placement. So I'm going to aspirate out about 10 milliliters or so of stomach fluid and I'll go ahead and clamp this tubing. And use my pH strip and the pH scale to confirm that it's about 4.0, meaning that it is in stomach contents. All the while I'm doing this, I'm also making sure that my patient isn't having any respiratory problems, and I'm observing the aspirate, the color, and the consistency. Okay, this is 4.0, so it is in the stomach. I'm now going to make sure this is secured and send them to X-ray to further verify placement. So once they're back from X-ray, I again want to make sure I verify the marking on the tube, that it's in the correct place that it was when they left. And I'm also going to measure the amount of tube that's outside of the body. I want to make sure that I never reposition a surgical gastric patient's tube. So once I've clamped my tube, removed my syringe, I can go ahead and cap my tube. I'm going to make sure that this is secured to the patient, again with the tape, and to the body if necessary, but sometimes if it's on the gown and the gown comes off, the tube could come out, so be careful with that. And I'm also going to provide oral hygiene at this time and nasal care, and I'm going to make sure that my patient is in a safe position with the bed down in its normal position and the rails down. Make sure they have their call light and know how to use it. So make sure they have their call light. And I can remove my gloves and wash my hands. And I will go and report and record my procedure.